Hypertension is a huge problem in Zanzibar. And that is because if you go to OPD in all Zanzibar hospitals, PHC units, and even in Nazi Moja, you'll see the number of hypertension cases is high. It's big compared to other problems. So hypertension is a very, very big problem in Zanzibar. And if you look on the South District or Makunduchi per se, hypertension is also huge. At Makunduchi, we are having a clinic once a week, which is Tuesday, and the number of patients attending the clinic is big compared to other diseases or other problems. And it's about 200 and something a month coming down for the visit at the clinic every month, just for hypertension.
Hi, my name's Carla and I'm one of the HIPS volunteers. Over my 6 months working in Zanzibar, I work closely with the staff in the hypertension clinic. We focused on 3 key areas, which were standardising patient care, improving patient flow through the clinic, and increasing accuracy of documentation. We were able to produce posters which were used by clinicians to guide them on how to conduct the clinic. This allowed them to provide consistent messaging to patients, and it also provided guidance on when to escalate management and what medication to reach for. In addition to this, we were able to provide education sessions for all of the staff that were rotating through the clinic on how to use those posters and also how the clinic structure worked. We also were able to reallocate human resources and also procure equipment, which allowed us to provide more thorough assessments and examinations of each of the patients. This included taking a blood pressure, measuring a patient's height and weight, and thereby being able to calculate their BMI. Through improving the patient flow and also having better human resources allocated to the clinic, the clinician was able to spend more time with each patient. We overall were very pleased with the progress that the hypertension clinic made and felt like the quality of care that was being provided improved greatly over that 6 months. I would just like to take the opportunity to thank you for all of the support that you've provided in allowing that to happen.
Hi, my name's Lindsay and I'm one of the current HIPS doctors volunteering in Zanzibar at the moment. Thanks to Festival Medical Services, HIPS has done a great deal for mental health services on the island. In 2014 we set up a clinic in Makunduchi Hospital in the south, where previously there were no mental health services at all and people had to travel into Stone Town in order to access any services. So a nurse was trained up, a local nurse working at the hospital, and we used the WHO's Mental Health Gap Action Programme manual. So with the help of that and ongoing input from volunteer doctors like me, the clinic's running really successfully and independently, and patients have been very satisfied with the service, as evidenced by a patient satisfaction questionnaire recently, which showed an overwhelmingly positive response, and a lot of patients saying that the clinic had really positively impacted on their lives. We also set up a clinic in Kivunge Hospital in the north of the island, where we're also seeing lots of patients. So patients come with problems like depression, anxiety, psychosis, and even epilepsy, which is seen in Zanzibar as a mental health problem. So both clinics are providing a really helpful service to the local population, and we hope to continue increasing our patient numbers because we feel that there are probably plenty more patients out there who might benefit from our services. So we've run a couple of outreach programs in the north and in the south, visiting primary healthcare units and spreading the word about the services available to try and reach people who might be in need of support. We've also been working on the supply of medication to the clinic, which is one of the ways in which we treat people, but not the only way. The supply from the government of drugs is often very intermittent because of problems with funding, and so patients will stop and start their medication because they can't afford to buy in private hospitals, in private pharmacies outside the hospital. So we've bought a batch of medication which we are helping the hospitals to sell at cost price, which is a sustainable model because patients will pay for the medication at a minimal price, and then that money will be used to buy a new batch of medication, and then the scheme can go on. The prices that patients pay will be much lower than that they would get outside the hospital in the private pharmacies, and so it makes taking medication daily a much more affordable thing, because unfortunately at the moment free medication is not always available. When it is, patients have it for free, and when it's not, the hospital will sell it at cost price. So we hope to continue our good work in Zanzibar with mental health services, and hope to continue expanding and improving our clinics with the help of funding from people like Festival Medical Services.
Okay, in Makunduchi we have a psychiatric clinic. We help them the patient with mental illness. Some of them depression, anxiety, but most of them is epilepsy. Epilepsy, the patient is a major problem in our district. We help them by using WHO guideline. The clinic is very good. We have some people or some trainers who in our clinic.